Hello?
Hello?
Is it just you and I?
Can you hear me?
Yes.
See me?
Yes. Now we have to get the other group, other members.
I sent it to them. Hopefully they're watching. I'm missing one person though. There's Deanna, Pam. Let me see who I'm missing here. Casey, Chloe, Deanna, Eileen, Judith. I think I got everybody. Pam,
Deanna,
Casey. We're missing
Chloe,
and Eileen.
I'll send them
a message.
Thank you. Chloe, Eileen. What a pain. There's Eileen.
Hey. Yeah, all the other people need to leave the other call. They were still kind of hanging on.
Okay. So who are we missing? Deanna, Casey,
Pam,
Chloe.
Let me see if
all of our issues.
I'm going to tell them to hang up and join this call.
Tell me if I need to invite them. Oy
Yes,
vey.
Okay.
Okay.
Hopefully they'll come.
It'll come.
Yeah, I'm going to mute
I'm
so
going to
the
mute so
echo
the
will
echo
go
will
away.
go away.
Yeah. All right, folks.
All right, folks.
1 minute.
1 minute.
Casey, Chloe, Deanna,
Deanna,
and Meg.
Meg.
Meg here?
Meg
No.
here? No.
I didn't invite her. Let me read
Let
her.
me re-invite her.
Okay, everybody's invited. Okay, Deanna, Casey, Pam. All right, guys, I'm going to continue and we're going to hope that they can join us. Can you guys man your Margaret Gill? So we got Meg here. So we're just missing Chloe, who scares me. All right, so I want to talk, started talking about measures and about outcome measures. So you have your team ramp, and if you have 50 people on your postpartum floor and you're working on lactation, it may be very important. There's Chloe. It may be very important for you to actually measure if you've gotten everybody on your team, you've done that education, you've done that engagement with them. But if you have a team of 2 or 3, using for your process measure number of participants who come to the meetings is probably really useful for, or useless for you. Okay, so I want you to think about what your outcome is and then picture that. Okay, so if I have an engaged team or a educated team or a, whatever, what is the process that's going to get me there? Okay.
Can I say what I had thought?
Please.
What about like pre and post tests for the staff?
So what do we know about this project? How long is it going to last?
Is it the 8 weeks?
Mm-hmm. So you have to be collecting data every 2 to 3 days so that you can, you all have seen the run charts, correct? Yes. Okay, so you need to take a look at those run charts. That's how this, when we look at quality improvement, we're looking at data over time. And so you can do a pre-test and a post-test, Casey, but you have to do something with that team over 8 weeks. So you can imagine you're not going to do a pre and a post test every 2 to 3 days. Your team engagement ramp is probably the only ramp that it's acceptable to say, you're going to do something else with them, but I'm also going to do a pre-test at the very beginning and a post-test at the very end. If you think that you're going to be educating them for 8 weeks and there's really going to be a difference, okay? So that's what you want to think about. If you're thinking about engagement, if I think about postpartum depression, engagement is My team understands that this is super important. They understand the prevalence of this. They understand how this can lead to further morbidities, even mortality, sickness for your site, days off of work, etc. And then, so if they were to be engaged, if I want to increase my engagement and my understanding and my competency of my team, I'm going to have my team participating in, they could be participating in,
Oh gosh, we can't hear.
Are you unmuted?
Judy, now you are muted. No, I can see your mute sign is on.
can you hear me now?
Yeah. You're
I
just
swear to
muted.
God, I haven't touched a thing.
There's a ghost in the machine, I think.
I think so. And I'm blaming Chloe. That's my out there. All right, so Casey, so that's where you would, your team engagement, understanding, competency, those kind of things. And then you would have to think of your process of what you're going to use to get them there. They're going to attend your in-services. They're going to participate in a conference that's coming up. They're going to they're going to participate in motivational interviewing. You know, whatever you're going to do with them, that can be your process that gets your team engaged. Does that make sense? Does everybody kind of see that?
Chloe, are you able to hear?
Chloe? Oh my gosh.
Yeah, I don't know what's wrong. We're not having good.
Wow. Can anybody hear me?
Yes.
Mhm.
Yes.
I can hear you.
Yes, we can
You
hear
cannot
you.
hear you. Obviously, Chloe can't. I don't know what to tell you, folks. So, Casey, you can hear me.
Yes.
Deanna, you can hear me. Margaret, you can hear me.
You can hear me?
I can.
And Pam.
And Pam.
Yes,
And
I
Eileen,
can.
I know you.
I know you.
Oh, poor Chloe. I don't know what to do for Chloe.
Yeah, I don't know either.
Eileen, maybe you can you do on the screen chat with her and see if you can help her?
I can. I just wonder if it's her internet.
I'm wondering, oh, she just went out. Maybe she's going to try to come back.
Come back in, yeah.
All right, so let's move on now briefly, because I just want to give you an overview, and I've already been here 45 minutes, and unfortunately, I so apologize for all the crazy IT stuff. Deanna, if we look at you, what would you want for your patient, your outcome of your patient? And Deanna's doing, Deanna, ACP, Advanced Care Planning. So Deanna, what do you want, if you look at your ideal patient, where you want your patient to be, what is that going to sound like?
I want my patient to have a healthcare surrogate on file. So in case they cannot make decisions for themselves, that someone can make decisions on their behalf.
Okay.
So patient safety.
Okay, so I'm
And
so excited.
whether or not, yeah. Sorry.
You really gave us almost your aim or your process. To have something on file might be your process. So what we're looking at is patient engagement. This is where everybody makes a mistake, and that's why I'm trying to really focus on the team and the patient. I want you to think about, Meg, I'm going to pull on you. Meg, if your patient is really engaged, what are they going to be?
Breastfeeding.
They're going to be breastfeeding, right?
Yeah.
So how are you going to, and pretend that you have an American population, because
Okay.
you got a really one that we're going to have to work with. But
Okay.
how are you going to get them engaged? So your outcome is that you want them engaged.
Mm-hmm.
What is your process to get them engaged?
Well, I think the first step is a discussion, right? You and I talked about a shared decision tool because you have to get them thinking. That I think is the first step.
Okay, so a shared decision-making tool, so utilization of a shared decision-making tool is a great process to increase your patient engagement. Does that make sense to everybody? So Deanna, you had a great outcome there, but it just wasn't your patient outcome, and your process have to be patient-centered. you're really thinking about if my patient is fully engaged, or you can use understanding, or you can use confidence with, you know. So you could also look at, so for Deanna, looking at advanced care planning. So let's everybody think of this. What could we say for Deanna's outcome for her patient ramp? What would be some possibilities?
Well, I want them to have advanced care planning discussion, a conversation.
So your outcome could be that they're engaged, and your process could be that they are participating in this discussion.
Okay.
Does that make sense?
And that's my process or my outcome?
Your outcome is that they're engaged, and your process is that they are participating in whatever tool you choose.
Okay. I've got that conversation project tool.
And there's lots of stuff in there. And actually for things like advanced care planning, on the IHI website, if you go in there and look for outcome measures or measures and advanced care planning, cha-ching. So you all might want to go to that IHI website and take a look what they have, because some of the big things, they have diabetes, they have advanced care planning. There was a whole slew of them when I was on there yesterday. Go and look and see what they have. They have some that are already there.
Okay.
So remember
I do recall seeing those, but I think with
there's
everything else, we get an influx of everything, and it's like
yes. I think actually, Deanna, I think there's some in that huge package that you have for the ACP. I think there might be some in there too. So things like ACP are so huge and so important and prevalent that there are some already done measures, and you might have to morph those and twist those, but it's going to help you look at what is a measure. Okay. So for your team ramp and your patient ramp, you really want them to be focused on the patient. And so I'm going to tell everybody this. I don't care what you do. Let's do smoking cessation, as I said earlier. No brainer, right? We all know this, but people still smoke. The key to getting this changed is your team engagement and your patient engagement. And so if you think of team engagement, your team is fired up. Everybody, that MA who checks them in, or the front desk person who checks them in, the MA who takes them to the room, the provider who sees them in the room, the lab person who sees them before they leave, and the parking lot attendant who walks them out the door, if they are all thinking depression screening, how much better chance do you have of getting your job done? So everybody's got to be on board, fired up. They have to understand why this is important, what the prevalence is. Like, did you just pick this out of the air? The more you can draw them into your project and engage them, participate with them, make decisions with them, you are going to have a successful project. The other half of that is the patient. You've got to do the same thing with them. You've got to draw them in. This is why this is important. Is this important to you? Because if it's not important to you, you get a pass. Because if they don't want to quit smoking, you can still educate them, but they've made a choice, and that's okay. You've done your job. Are we all on board? Does that make sense? Okay. So let's try Pam. And Pam, you are doing chronic pain and BMI, right?
Correct.
So Pam, I'm guessing you want to decrease people's weight.
Yep, exactly.
So what would one of your processes be? What is something that has to happen in your office?
Well, I think a big part of ours is, I think a lot of our rooming staff and nurses and such, of course, they're all young 20-some-year-olds and of course have no weight problems. I think sometimes they need to be more educated on what some of the causes of obesity can be, you know, not being judgmental, being aware of what some of the problems that obesity can cause. I think there's a lot of educational lack of education there with the staff.
I want everybody to help Pam. Is she talking about a process, or is she talking about her team?
The team.
Team outcome.
She's talking about her team. And those are great.
And those are great team thoughts.
But Pam, what has to happen in your office?
office?
Like, how is this?
Like, how is this going to happen?
Are you still there?
Mhm.
Oh, okay. All of a sudden you were frozen. As far as getting the patient engaged,
Patients get their weights.
Get their weights.
the patients get weighed, correct?
Okay.
Those
Do they
that
get a height?
They get a height.
No, we don't have anything currently to measure their height with.
So one of your
one of your
issues, one of your processes is going to be you've got to get their height and weight.
height and weight.
Correct.
You may have to.
You may have to
go in with your
go
team.
in with your team.
You're gonna have to
Educate your team
on how to get a height and weight and figure out the BMI.
the BMI.
So in your screening of everybody, you want your ramp C might be one of your processes. Everybody's got to get
screened
because you have to
so
start
you
at
have
the
to start
beginning.
at the beginning.
And so you've got to teach your team up and back up in team ramp how to do that, right? And so if you're going to screen everybody, that's part of your process.
part of your process.
Your outcome with that ramp C.
That ramp C.
Okay. Going back into the team, I had a question when you were talking about that. So would it be possible to kind of educate in like little huddle, maybe every 2-3 days, kind of bring up a new topic with the team, maybe 5 minutes before the clinic day starts and educate them like that?
Yep.
Okay.
Yep.
A lot of people have a kickoff to kind of get going to show them all
that
are
are happening.
But yeah, every couple to do huddles every day, every other day, every week, however that works for you guys.
Okay.
And remember,
everything
these things that you do,
you're going to want to
how you measure them. And I want you
And I
all
want
to
you
go
all
back
to
and
go
look
back
at
and look
QI
at
102.
102.
It's about an hour
It's
and
about
10
an hour
minute
and 10
video.
minute video.
And you're ogring.
And you're ogring.
I can't remember what chapter. I have it right here somewhere. And look at measures and operationalizing them. Okay.
Chapter 6.
Thank you, Deanna. All right. So, Chloe, we're going to try with you.
I know.
Chloe, you're doing peripheral vascular disease.
Yes.
And you want to screen, you want to screen people, right?
Yes. High risk patients.
And then, so what could RAMP D, remember at the very beginning, I said, we're not just going to screen, we're going to screen and treat. But for you, treating these people might not be exactly the same. You might have, these people are, you might have to screen them like you rate a 1 to 5 risk, you rate a 7 to 8 risk. And so for your 1 to 5s who are very low risk, but maybe they have diabetes, you're going to do some preventative work with them. The appropriate treatment might be.
In terms of the screening, if they're high risk, they would all be screened. So not necessarily from like, if you're this risk or that risk. If you're in that high risk category, whether it's because you're a smoker or because you have diabetes, we would screen them all. Now, according to what the ABI numbers will reveal, then that has to do with what type of treatment they would get. So
That's what I'm
do you
talking
need
about.
to
Yeah.
therapy?
I didn't mean to say that you wouldn't. You're going to screen everybody.
Right.
Everybody
Okay.
who walks in your door that is whatever category you're looking at. And you could actually screen everybody because that's depending on what you're looking for. Again, it's not what we think, it's what the evidence says. Okay?
Correct.
So in your referral and treatment, what I'm saying is if you screen somebody who has diabetes, that would be one of your patients, right? But maybe they're a 25-year-old healthy diabetic doing well. You still have something to do with them, right?
Correct.
They don't have any problems yet.
Right.
But you're still going to educate them, maybe do a foot exam, yada, yada, yada. But on your patient who's a 70-year-old diabetic who's on insulin really bad and has foot issues, that's going to be a different treatment.
Correct.
So what I'm saying is you could look at what's called appropriate treatment. And so that would be kind of a bundle. For my people who score a 1 to 5 on whatever that screening test is, you guys should have this treatment. And for people who score a 5 to 7, you people need to have this treatment. So even though people aren't getting the same treatment, it's appropriate, it's the best care treatment.
Correct. Right.
Does that make sense?
Yeah.
So your screening might be just, I'm screening you for hypertension and you should be on medication, period, the end. But then there are some people who a bundle, a package kind of applies to them. And that's going to give you a bigger scope of people to look at. Same with depression. You know, you might score 1 to 5 on the PHQ-9, and that means you really don't have depression. But that doesn't mean that I can't educate you on what depression is, because we know that 30% of the people walking around have depression. Right? Or if you score a 5 to 9 on that depression scale, I might say, you know, have you thought about counseling? We have a counselor here, behavioral health, whatever. Or they score a 20 and you're like, you know what? Let's walk you over to the psych ward, you know?
Right.
So there's different, and that could go for many of you. That could go for many of you. So that's one type of a outline, is called an SBIRT, a screening, brief intervention, and referral to treatment. Not everybody has that, but for those of you who are looking at screening, that's one of the methodologies that you can use. Okay. So we've looked at team outcomes. We've looked at team processes. This is just the tip of the iceberg, folks. We've looked at patient outcomes and patient process measures. So the patient outcome is that they would have an understanding maybe of they would have a perception that their support system was very strong on a Likert scale of 1 to 5. And how are you going to operationalize that? Meaning, how are you going to measure that? You're going to give them a Likert scale with 4 questions, a survey at the end of their visit. And it's going to say, do you feel well supported? Do you understand your options for care? Do you feel like you know the resources that are available to you? And then always an open-ended question. You know, and then bang, you have a score now on these patients, and you can watch that score and see if, as you're implementing your project, they're feeling more confident and more able to know their resources, et cetera, et cetera. Okay. And there's all sorts of ways. And what you want to really think about is choose measurements that, first of all, just think about how this process is going to happen, and then start to put it in the words of patients and teams and processes. But first, put your brain around, like, where do I think I need to go? I need to increase breastfeeding, or I need to at least get people the BMI on the chart, because I can't even begin to go anywhere else till I get the BMI on the chart. How is that going to happen? That's your process. And then what am I going to do with them? So that's going to be your next ramp, Pam, is what am I going to do with these folks once I get there? What does that mean for them, you know? And with pain management, there are some great tools that I think we talked about this, Pam, that relate pain and weight. And so people can really look at that, and that can be a huge wake up for them. Setting goals, personal goals. Okay, so who has questions that we haven't I've tried to hit everybody.
I have a question, and I think some of this might be because I didn't hear some of the things in the beginning.
I'm so sorry.
So my project is like a screening for a screening. So it's basically like implementing a questionnaire that the patients will fill out, so that it has that patient engagement aspect, so that it kind of wakes them up to say, hey, maybe I should be screened for this. And they would fill out that questionnaire while they're in the waiting room. And then when the provider sees the patient, then they would say, okay, this patient needs to be screened with now this test, or they don't need to be screened for the test. So it's kind of like 2 different screening tools that would be implemented, because
it's okay, because what your referral and treatment is a screening.
Right. Okay. I see.
You're going to screen everybody. What you're doing is not it's more like a risk assessment. You know, everybody's going to get a risk assessment, and then you're going to get screened.
Okay. Okay. Perfect.
Okay. A couple things you want to think about. I need to have enough of a population to do this with. So I have someone who wants to do sexual assault victims. I said, how many sexual assault victims do you see in a week? 1 or 2. Well, that's not going to work, you know? And you may be very interested, Chloe, in the people who have this disease and treating them. but you got to screen everybody and then
Right,
treat your
correct.
particular people.
Right. Okay.
Okay. Now, an SBIRT is one way of doing this. Not everybody does an SBIRT. An appropriate care is another method. So it's just how you're going to figure out your plan of attack. Think in your brain, what needs to happen? Where am I going to go? How do I need to get there? Okay, I need to take their BMIs. I need to see, do they have an intention to breastfeed? Because if they don't have an intention to breastfeed, I got nothing. You know, Deanna, what are you doing? Oh, you're advanced care planning. And yeah, so Deanna's a lot about starting those conversations. And Deanna, a lot of yours is going to be intention. So Deanna, tell me what situation you're in, what clinic?
I'm in a hospital.
And dealing with what kind of patients?
So, palliative care nurse practitioner.
I didn't hear you.
Palliative care nurse practitioner.
Okay, right. Okay. So you really have patients who are in palliative care already?
No, because we are building a program.
So you have so many choices.
I do.
You have so many, and you've got so much support behind you.
I hope so.
You just have to think about, yours is going to be, what can I do in 8 weeks?
Right. And
You know,
that's why
because-
I went after advanced care planning as far as living will and those directives and having that conversation,
Yeah.
because that's something, whether you have a palliative care service or not, that's a need in the hospital.
Right. Absolutely. And so you broaden your population by, one of your ramps is you can possibly extend to the hospital as well.
Right. So
Okay.
I wanted to start out in a unit
Right.
and get it going there. So that's my goal.
Absolutely. Absolutely. Okay, folks, my goal today was just to give you an idea of what the measures are, how you get there. I encourage all of you, Deanna says it's chapter 6 in OGRINK, read it again and look at your IHI-QI module 102 and review that. Eileen, are you waving at me? And then there was, I think in my shutting down of my computer, I lost it, but you have the measures worksheet that Diana sent out again, and it is in your module. And it has, what is the thing I'm going to do? So I'm going to educate my team this week. I'm going to have an in-service and a party and a kickoff party, and we're going to educate everybody on the whole process. That's what you're doing. And then your outcome measure is that I want them to be feeling competent and capable in screening and doing all of these things, screening and treating. And your process is, we're going to use this algorithm. And then your aim is, we're going to decrease the incidence of complications in peripheral vascular disease. So each one leads to the other one. And outcome measures and process measures are just the way you define it and how you say it. So you are going to have an outcome and process measure for your team. That's 2. An outcome process measure for your patient. An outcome and process measure for whatever process you've come up with for both of those. And then you're going to have at least one balancing measure. And we talked about, I think, balancing measures when we fell off the when we fell off the block here. Your balancing measure is what goes askew. Too much time spent, missed something else. What goes wonky if you're spending too much time on this one project? Okay. Does that give you all a little bit of a clue as to how we're starting here? Do you all have a somewhat of a vision of where this is going?
I don't feel as clueless now.
I love that. I love that. And the thing is, you all have your continuity faculty. Make sure you snag everybody. Make sure you come prepared, though. Look at those 2 modules first. Look at the examples and look through the module in the unit, because there's some great examples in there. And go to IHI because they have some great examples. You do not need to reinvent the wheel here. You'll have to morph it for your particular site. Okay? Questions?
Can you
Open
give us
floor.
Can you give us a couple of examples of the process measures? Are they always going to be some type of audit tool, or are there other ways that we can measure?
Mm-hmm. So let's think of a team engagement, let's say we're working on the team ramp. No, let's say we're working on your screening ramp, and your outcome is for everybody to be screened. All the patients that come into whatever that clinic is that you have, they're all going to be screened for peripheral vascular disease. Your process might be that there could be so many processes, right? There could be zillions, but your process could be that you're going to find a tool. Tools are wonderful things. You're going to find a tool that uses an algorithm so that how are we going to help these patients get screened? Wait, am I doing the wrong one? If you want them to be screened, your tool could be that they participate in the shared decision-making process, but then we're double dipping. You see what I mean? We're saying we're actually using the process for the patient engagement ramp. So we need to think of a process if we want them to be screened. I mean, you could say that the MA is going to screen them before they get in the room. You could say that the provider is going to document the score.
So my process change would be the questionnaire that they fill out while they're waiting in the waiting room. So everyone would fill that out, but then my change measure is what I'm having a hard time with. Like, how do I quantify that?
So then what you're going to do is you're going to say, how many people were in the waiting room? How many people did we see today? 25. I always I like to use examples of less than 10. We saw 10 patients today, but only 5 of them completed the survey. So today you got a 50%. So it's the part over the whole. It could be a score on a test. It could be, if you're doing appropriate use and there's 3 appropriate uses, you screened them, you gave them the brief intervention, and then you appropriately, for you, it's a risk. They did the risk assessment. They did the screening, which is the risk assessment. They were appropriately treated, whether that's to have more screening or to take medication or whatever it is that they need to do. Go away. Sorry, that's my dog. Does that make sense?
So would my process measure then be that, at least 50% of all the patients that come into the clinic fill out this questionnaire?
That, if you're talking a patient engagement tool, that's patient engagement.
Correct.
That's where the difference is. So you have to, again, they do run into each other, but they're not the same. So that's why you make that's why you want to make sure that you write down that operational measure definition right next to it. Because if you come to 2 things and you're measuring exactly the same thing, you're double dipping.
Right. Okay. I see.
So I'm not answering your question.
No, it's okay.
But I'm showing you how to get there.
Right. Okay.
Okay. But they all have to do with decreasing peripheral vascular disease. But just ask yourself, is this the patient being engaged and participating? That might have to, obviously if you're screening them, they're being screened, right? But if they're doing a shared decision-making tool, that's really, in general, it could be both. You could do something different for your team, for your patient engagement. That could be completely different if you wanted to. And you could use that tool as your process for screening everybody.
Okay.
So it could go both ways.
Okay.
Did I make you more confused?
No, I think I'm okay.
Things can be used for some outcomes could be outcomes or processes depending on what you're looking at. But the outcome is usually kind of the end point. What's my end goal for these folks?
Right,
Not the big picture, but in that process, in that ramp.
Okay.
Okay, who else has a question?
I have 3 questions. Is that okay?
Yes.
Okay. Number 1, where do we find the run charts? You said, haven't you looked at the run charts? And I wanted to make sure I knew where to find them.
So that's in QI 301.
Okay.
And as you go through that, you don't even have to create the wheel. And also in IHI, under the thing it's called is the tracker. I found it yesterday. It is such a cool measures tracker or something like that. Just go into IHI and type in the search tracker.
Okay, I'll do that.
It's a very cool thing.
Second question. For this, this assignment of the Buzz session is due on Friday, but are we actually turning anything in?
I have to look at the assignment.
It's not very clear on the assignment. And if we're not, can we email you our, what is it called? Can we email you the measure worksheet and see if we're on the right track?
Eileen, what do you think? The only reason I'm saying that is I'm going to get 90,000 people sending me their measures worksheet.
I was going to pull up the assignment so I could look really quickly.
Yeah, if we don't have feedback on it, I'm sort of
Meg,
like.
You're mine. So yes, you can send me yours.
Okay.
But I would say your measures worksheet should go to your faculty, your continuity faculty, if you have questions.
Okay. Okay.
And Eileen, are you looking to see? I keep track of who comes and who participates.
I'm looking right now.
What was your third question, Meg?
No, those were my three.
Oh.
It was what do we turn in? And if we're not turning this in, then can we show it to you and get feedback to see if we're on the right track?
Sure. Yeah. How about any other questions? No, well, this felt completely discombobulated. I am going to post it. I don't know what I'm posting, but I'm going to try and post it because of all of the, I'm not sure if everybody's having storms. I am having a Arizona storm, which means I have thunderclouds out there. But, I do apologize for all the crazy IT stuff. I'll post it if you have questions. I'm glad to help you with them. This is we're going to have 4 opportunities for you to start working on your measure. This is the first one. Your draft is the second one. The AIM game is the third one. And so then hopefully by the time you get to your final charter, that's going to be good to go. So we've incorporated 4 places to get you there.
Yeah.
So don't worry.
So if my draft is completely off, let's just say I just went, I just didn't understand. Is that like you guys are going to be understanding in the grading process and we have that room for improvement, but as long as you guys see some type of improvement from the draft to the
when you get to the final, it needs to be done. So the final needs to be done. So that's why there are several weeks between the draft and the final. And again, that's why, if you look at that charter, the first part is what's the problem? The second part is, so what's your local data? This is not brain surgery, right? Your fourth is, what do you expect? If you do this, what do you expect? What are the benefits, right? That's another one that's a no-brainer. Your measures start to where it starts to get into be a little bit more tricky. And that's why, as I said, we're giving you 4, besides what you read and you do, we're giving you 3 opportunities really to have us keep giving feedback to you so that we can help you get it. I'm trying to think of the charter. And then it's what you're going to do the first week. So with my team, I'm going to have a kickoff. With my patient, I've got a shared decision-making tool. With my staff, we're going to start screening everybody, and providers, we're going to start appropriately treating. So you know exactly on each wrap, you don't need to know for 8 weeks. You need to know Monday what I'm going to do and how I'm going to measure it. So if you think in your head, 4 ramps, outcome and process measure for each one of those, plus a balancing measures, 5 measures, and all of them are operationalized. I'm sorry, 5 areas. There's not 2 on team, 2 on patient, 2 on process, and 2 on the second process, plus your balancings, 9. 9 outcomes, 9 processes, 9 operational.
Okay.
I promise we'll get you there.
It looks like there's a Dropbox for that measurement worksheet.
Okay. On the Buzz session assignment page?
Yes. Mm-hmm, mm-hmm.
Thanks, Eileen.
Oh, I don't.
Do you not see a Dropbox there?
No, I don't see one on mine.
Oh.
Yeah, I didn't see one either when I looked earlier. It was. I thought that we were being graded on, I guess, coming to the Buzz session, it seemed like.
That's what it has been in the past, but I tell you what, if we find something differently, we'll let you know.
Okay, thank you.
Yeah, I think it might be helpful if we had a Dropbox so you guys could just upload what you come away with tonight with your at least your beginning ideas.
Because in the one that for the charter draft, it says that we're to upload our measures there. So that's why I thought that was due at that point. And
it is.
Okay.
It is due at that point. I don't know. Okay. I have to tell you, I haven't re-looked at. There never used to be anything that you submitted. It used to be a survey that you took. But I'll let you know if there is anything.
Okay.
I am going to make a recording of this ridiculous piece of loveliness, and I'll put it on the sign-up sheet so you guys can access it. I'm not sure how helpful it will be, but it will be there.
Okay.
Dr.
All right.
Butler, will you share the sheets that you screen?
Sure, I'll send them to
today?
everybody.
Okay, great.
Yep.
Okay. Thank you.
All right, everybody? Okay, everybody have a great night, and we'll see you in a few weeks.
Few weeks.
Okay.
Thank you.
Okay.
Okay, everybody,
All right,
take care.
Thank you.
Good night.
Bye.